Hi, this is for checkoff number 2, torticollis and hip dysplasia. So I have my patient here, and really quickly we are going to do a Barlow test. And so a Barlow test is good for children under the age of 3 months. So if they're older than 3 months old, you wouldn't want to perform these tests. They're not as accurate. And what we're looking for here is we're screening for hip dysplasia. So a Barlow, what we're going to do is we're going to bring the legs into this 90-90 position here. So knees, hips flexed, knees flexed in this 90-90 position. You want to make sure they're in midline, so they're adducted. And then you're going to apply a slight posterior force. You're going to want to be feeling on the back of the thighs to see if you can feel the subluxation. A positive is a pop, so you'll feel or hear that head of the femur slipping out of the acetabulum. So those are your Barlow tests there. Now we're going to move into torticollis. So we have a 5-month-old here with right torticollis. So how right torticollis presents is you are going to have right rotation and left lateral flexion. So that is going to be the preferred position for this child. And if we want to get some objective measurements for that, we can either use a goni or we can use a fancy-dancy arthrodile here. So for our goni measurements, what we're going to be using as our landmarks, we are going to have the stationary arm at the at the acromion. So you'll want to palpate that shoulder for the acromion, have that stationary arm out at the side. And then your moving arm here is in line with the nose. So you want to keep all those nice and steady, and we're going to have our patient move into right rotation, moving that moving arm with the tip of the nose here. And that's going to be 40 degrees there of right rotation. Then how we can measure lateral flexion with our goni is we're going to have the moving arm down the back of the spine, so right in line with the spine. Your fulcrum is going to be right on that C7 there. And then the moving arm is going to be in the posterior midline of the head. So stationary arm down the spine, moving arm on the posterior side of the head. So we're going to bring our patient into left lateral flexion, bringing that moving arm with us. Everything else is staying nice and stationary there. And there we go, about 45 degrees of left lateral flexion. So if I was describing this to a patient, we'll pretend that our screen is the parent. Really quick, our passive range of motion, the norms we're looking for in an infant are 100 degrees of rotation greater than 65 degrees of lateral flexion. So those are our norms that we are looking for. And then in terms of the arthrodile, let me show you some measurements here for that. So if we are working with rotation, we're going to want to have the arthrodile coming up over the head here. And then what we're using is we're making sure our arthrodile is nice and level in line with the shoulders. And then again, we're using that tip of the nose for reference. So we would want someone else here stabilizing those shoulders, making sure that our patient wasn't moving, like trunk and shoulders weren't coming up with us, but we would move into rotation here, getting about 40 degrees of that right rotation. Then for lateral flexion, we put the arthrodile down on the treatment table, still using that tip of the nose and our shoulders to determine that line there. And then we'll use the tip of the nose, bringing our patient into that left lateral flexion here. You can see there. And again, using that tip of the nose for our reference, and that would be 45 degrees of lateral flexion. So that's how you measure with either the goni or the arthrodile. So arthrodiles are great. They're actually determined to be more accurate than our goni. They are difficult though, because if you have a really squirmy child, or if you don't have someone to help you control their shoulders, control their trunk, it can be difficult to do that. So gonies are totally acceptable and maybe a little bit more user friendly. So those are our two things. And then if I had a parent, and now we'll pretend the screen is the parent, and I was educating them on their child's condition. So, hi, my name's Hannah. I'm going to be your student physical therapist today. So your child is experiencing some torticollis. It's a very common symptom. It's a very common condition, and luckily with some stretching and some strengthening, we can really start seeing some results. So for that right torticollis that your child is experiencing, they're going to be in this right rotation, left lateral flexion. So their nose is going to be going towards their right side, and their ear is going down towards their left shoulder. So that's going to be kind of their preferred position. That's where they're going to be resting in, and that's because this muscle on the right side is tight. So what we want to do is we want to stretch out that right-sided muscle. So how we stretch is we're going to go into direction opposite of how they are tight. And right now your child's 5 months old, so we're really working on independent sitting. That's going to be his next big milestone that we're working towards. So I would recommend actually stretching him while you're practicing this independent, maybe supported sitting. So you can do it here in this position, just kind of be behind him or in front of him, engaging, and then also stretching at the same time. You can also always prop up, well, this is hard to see, prop up your legs like so, and place the child in your lap. That can kind of be working on those core muscles, and then you can be stretching him from behind. So I'll show you how you need to stretch your child. So let's pretend he's in this seated position here. So again, if he's in that right rotation, so his nose is going towards his right side and his ears coming down towards that left side, the first one we're going to want to do is we're going to want to bring his nose to the left side. So you can come from behind, just very gently bringing his nose over to the other side. You're going to want to hold this position here for about 30 seconds. Again, be gentle, be nice, make sure that your child isn't fidgeting too much and is enjoying the movement. So you can be here facing him, engaging him, and stretching at the same time. So you'll want to do multiple rounds of that, okay? The next one we're going to want to work towards is we want to bring that right ear to that right shoulder. So again, coming from behind, you can use both your arms, both your hands, and you can just be bringing that head towards that right side. So that right ear towards that right shoulder. So again, can be engaging him, challenging his balance, making him work on his core while stretching all at the same time. And then we also want to be strengthening. Another big milestone at 5 months that we're looking for is rolling. So you can have your baby just down here facing towards the ground, and we're going to work on rolling. So you can bring toys to his side, encouraging him to roll to each side. And you'll want to work on rolling to both sides, because rolling one way versus the other actually has different advantages. So if he is rolling to his right, he's working that tight muscle, but if he hangs out here long enough, he's going to be getting that stretch because he's coming in. See how his nose is coming. So we're going to be stretching when we're rolling over to the right side, but when we roll over to the left side, we're going to be activating that muscle on the left side, making it stronger. And it's just a great milestone that we need to be working towards. So again, you can have some toys, encouraging him to roll over, look at you, using those neck muscles appropriately, all right? Let me know how those go, and if you have any questions, let me know. Other than that, that's our checkoff. Number 2.